Hello and welcome back to AP Psychology. I'm Miss Lee and we're still in Unit 7. We're now starting the subsection of Theories of Personality. This video will focus on the Psychoanalytic Theory of Personality. By the end of this video, you should be able to compare and contrast the psychoanalytic theories of personality with other theories of personality, and you should also be able to identify the contributions of Alfred Adler, Sigmund Freud, and Carl Jung, all key researchers in personality theory related to the psychoanalytic perspective. If you haven't done so already, go ahead and grab your notes and let's get started. So I've referred to it. Finally, we get to Sigmund Freud. So let's talk a little bit about the man. In his clinical practice, Freud encountered patients who were suffering from nervous disorders and whose complaints could not be explained in terms of purely physical causes. He was not a psychologist by training. Freud referred to this battery of symptoms as hysteria and said there had to be a psychological cause for the ailments he was seeing, and from this developed the very first comprehensive personality theory ever. One of the foundations of Freud's theory is that the unconscious is vital for diagnosing and treating these psychological ailments or hysterias, as he said. He believed that the unconscious mind was a reservoir of mostly unacceptable thoughts, wishes, feelings, and memories. Freud asked patients to say whatever would come to their mind, which we now know of as free association, in order to tap into the unconscious. This was one way that he went about exploring the unconscious. The brand of therapy that he used is considered psychoanalysis. This is the process of free association or chain of thoughts that lead to painful, embarrassing, and unconscious memories. Once these memories are retrieved and released, which is the treatment part of the process, the patient feels better. So let's have an example. A harmless example. Write down anything you think of when I reveal this word. Are you ready? Banana. The idea here is to think about how this harmless, innocuous word could potentially lead to the patient uncovering these unconscious, unthought of memories and traumatic events. It could be really any chain of events, but eventually Freud believed they would be uncovered through this free association technique. He believed that the mind is like an iceberg, and the largest and most important part, the unconscious, is hidden from our awareness. So if you look at this as a metaphor of an iceberg, the conscious is what we're currently aware of. It's what we know of as our being, our existence, our everyday selves. The preconscious is info that's not in our conscious, but it's retrievable as needed. It is able to be retrieved with effort. And then the unconscious is out of our awareness, yet it can still dictate our behavior. And so the idea behind psychoanalysis is to tap into the unconscious and be able to target those traumatic events, those undesirable wishes and thoughts, and bring them to the forefront so that they could be addressed. Notice in this view, you can see the tip of the iceberg above the water, that's the conscious part, as well as part of the iceberg just under the surface, the preconscious. But you really can't see the massive bottom of the iceberg, which is the unconscious. And that's really kind of the crux of psychoanalysis and this whole theory of mind that Freud came up with. Continuing on with this idea of unconscious influences, because free association is just part of it. You might recall from previous units the idea that our unconscious is also hidden in dreams, especially the latent content of dreams. The latent content is the part that is the symbolic meaning of the dream. It's not what you're actually dreaming, it's what it means. So these images are what is in your unconscious mind, and through dream interpretation, that would be the psychoanalytic part of the therapy. Other influences would be Freudian slips. These are slips of the tongue that Freud believed were our true unconscious thoughts surfacing. All right, so let's dive into his personality structure a little bit. We have the id, the ego, and the superego. Stay with me. All right, so the id, this is our unconscious, again, poking its head up, striving to satisfy basic sexual and aggressive drives, and it operates on the pleasure principle. It demands immediate gratification, Freud believed this was the first element of the personality that developed, and it's very infantile in structure. Then, somewhere between the phallic stage and the latent stage, the superego develops, and this is the part of the personality that provides standards for judgment. This is our conscience, and for future aspirations, it operates on the moral principle. Then there is the ego. This is the conscious executive that mediates the demands of the superego and the id, and it acts on the reality principle. So it really is the mediator that is the go-between. Freud believed that our personalities form during our very first years and that they are divided into psychosexual stages. During these stages, the id's pleasure-seeking energies focus on pleasure-sensitive body areas called erogenous zones. So starting out with the stages, we have stage 1, that is the oral stage. During this stage, the individual obtains pleasure from the mouth. The erogenous zone is the mouth, and the individual obtains pleasure from the mouth through sucking, biting, swallowing. And this should make a little bit of sense because what is happening around 0 to 1? Well, the baby is feeding and learning to talk and sucking its thumb, and everything is explored through its senses, and so things are going into the baby's mouth. This makes a lot of sense. The second stage is the anal stage. In this stage, pleasure is obtained by learning to control the bodily wastes. So the erogenous zone was considered the anus. And this should also make a little bit of sense as well, because what's usually happening between the ages of 1 and 3? Potty training. So the child is learning to control him or herself, and pleasure is obtained by learning this control. During the phallic stage, and Freud considered the phallic stage to be the most crucial stage, the individual becomes curious about the genitalia, and it deals with incestuous feelings. Okay, so just put a pin in that for a second. We're going to come back to this when we get to the Neo-Freudians, because a lot of people didn't agree with this. Surprise, surprise. So the first set of these incestuous feelings that Freud identified, he called the Oedipus Complex. And in this complex, a boy has unconscious desires for his mom and jealousy or hatred for his dad. He fears punishment, in other words, castration. So keep in mind, Freud was very into symbolism, and so punishment equaled castration in Freud's mind. So if the dad found out about the feelings, the boy was scared that he would be castrated. This should sound a little bit Greek. If you're familiar with the Greek tragedy of Oedipus, very much linked here. The Electra complex is psychoanalytic in nature, but Freud was not the originator of this complex. This is the female version of the Oedipus complex, and it was added later by Karen Horney and Freud's daughter, Anna Freud. During the phallic stage, children learn to cope with the threatening feelings through repressing, and they push them down, and they also begin to identify with the rival parent. Basically, it's the if you can't beat them, join them sentiment. And so you sometimes see hyper genderification, if that's a word. Little girls really wanting to dress up in, formal gowns and party poofs and royal characters. And the boys tend to, go very much in the masculine area. Now, this is not always the case at all, but this was what Freud saw and what he believed. So to explain this process, through the process of identification, the superego is gaining strength by incorporating the parent's values. The next stage is the latent stage. This is typically older elementary school, and during this stage, the individual is suppressing their sexual interests. They mostly play with their same-sex peers. So think about really most of the way through elementary school, even up into middle school. Then you hit the 5th stage, and this is the last stage according to Freud. This is called the genital stage, and this is around 12 and up. This is considered adult sexuality, and the individual expresses sexual feelings towards others. So this is where crushes start. Feelings of romantic love can start at the genital stage. So this is around 12 and up. A concept that's related to these stages is fixation. Freud believed that if some type of traumatic event occurred, one could become stuck in that particular stage of psychosexual development. So for example, an oral fixation. If the individual experienced some type of traumatic experience during the very first year of life, the individual could seek excessive oral contact through smoking, drinking, eating, anything that has to do with the mouth, chewing on pens. All of this was explained by Freud as an oral fixation. It could also be seen through other types of behavior that were linked to the mouth. So it could be dependence, it could be passive, or the individual could act very passive, or even use sarcasm. So you use sarcasm through your mouth. So Freud connected that to an oral fixation. If the individual had a traumatic experience between the ages of 1 and 3, they could be anally fixated. So they could become anal retentive, where they are very controlling and very orderly, or anal expulsive, so basically very messy, very disorganized. Freud believed that the ego uses defense mechanisms unconsciously in order to protect itself against anxiety that's caused by this conflict. Because it is between the id and the superego, there's naturally going to be some anxiety. So in order to protect itself against the id's demands and the superego's constraints, it would develop defense mechanisms. It's only unhealthy when these defense mechanisms cause self-defeating behavior and emotional problems. So Freud was generally okay with defense mechanisms unless it caused self-defeating behaviors. So let's talk about the defense mechanisms most common. There are a bunch of them, but here are the most common ones. Repression. This is considered the grand Mac Daddy of all defense mechanisms. This is how we avoid painful thoughts. We force them into the back of our minds. It underlies every other defense mechanism. For an example, if you witness a murder, you wouldn't remember the details when you were asked by the police. This is repression. It's just tamped down. Everything is just put in the back. Regression is when we retreat to behavior or thinking like a child in order to avoid adult issues. So throwing a temper tantrum when you don't get what you want, that's regression. Displacement is when you divert sexual or aggressive impulses to a more acceptable person or object. So you're angry at your mom, so you take out that anger on the family dog by yelling, of course. Kind of the classic is the one parent gets yelled at by the boss, so they come home and they yell at their spouse, who then in turn yells at the child, who then in turn yells at the dog. This is all displacement because you're not focusing your aggressive impulses on the individual that is making you feel angry. The person who you are diverting them to is a more quote-unquote acceptable person. Projection is when you disguise threatening impulses by attributing them to others. For example, you really want to break up with your boyfriend or girlfriend, so you accuse him or her of wanting to break up with you. That's projection. And I think of it literally like you're projecting something inside yourself onto someone else. Sublimation, this is when we expend energy on pro-social activities in order to avoid undesirable activities. So you like to hit things, so instead of hitting people, you take up boxing as a hobby. So you are channeling your aggression into a more pro-social or acceptable activity. Reaction formation. This is when you make unacceptable impulses into their opposite acceptable form. For example, you really dislike your psychology teacher, but you tell everyone how much you love her. And it's not lying. You really think you feel that way, even though Freud would disagree. Rationalization. This is when we try to create a logical explanation of our behavior in order to justify it. So you want to go to the movies with friends, so you justify going instead of studying for an exam by stating that you would have failed anyway. In denial, we refuse to perceive reality in order to protect ourselves from it. So you get a rejection letter from your college of choice, but you still tell everyone that you're going there. You're in denial. You keep thinking maybe something will change, maybe something will happen. All right, remember I said we would get to the Neo-Freudians? So psychoanalysis was very, very popular, and a lot of people agreed with what Freud had to say about a lot of his theory. However, they didn't believe in all of it. Like Freud, Alfred Adler believed in childhood tensions. However, he believes that the tensions were social in nature and not sexual. He believed that a child struggles with an inferiority complex during growth and strives for superiority and power. Like Adler, Karen Horney believed in the social aspects of childhood growth and development, and that children were trying to overcome a sense of helplessness. She countered Freud's assumption that women have weak superegos and suffer penis envy, and she actually came out and said that she believed that men had a womb envy. Carl Jung believed in the collective unconscious, and this idea is basically that within our society, we contain a common reservoir of images that derives from our species past, and it's full of these archetypes. Archetypes are the universal symbolic images that appear across cultures in myths, art, stories, and dreams. So, for example, we tend to see stories of evil versus good. We tend to see stories with a maternal figure or a damsel in distress. These are universal in nature, and they're very symbolic. They have a lot to do with the symbolism that are a trademark of psychoanalysis. So how do we assess the unconscious process? Evaluating personality from an unconscious mind perspective would require a psychological instrument. They used the projective test, and this would reveal the hidden unconscious mind. There were two main types of tests used. There was the thematic apperception test, still used today, the TAT, and the Rorschach ink blot test. The thematic apperception test was developed by Henry Murray, and it's a projective test whereby people express their inner feelings and interests through the stories that they make up about purposefully ambiguous scenes. So there are 32 cards, and they may have any meaning at all. You see these pictures, and there really is no direction about what that card is supposed to mean. The images are purposefully ambiguous, and basically the patient who was undergoing psychoanalysis would tell a story about the card explaining what was happening in the picture. Murray believed the test was most effective if the main character in the images was about the same age and gender as the patient. Here is an example of the TAT, and you see in this picture, there were 32 again, but you see in this picture, there are a lot of meanings that you could derive from just this photograph. What are those men doing to that man? Are they murdering him? Are they autopsying him? What's the kid doing there? So by looking at the picture and telling a story, the patient would be revealing their unconscious innermost thoughts and feelings. And then possibly one of the most widely used and recognized projective tests is a set of 10 ink blots designed by Hermann Rorschach. It seeks to identify people's inner feelings by analyzing the interpretations of the blots. And if you see here, if you stare at it long enough, some images do start kind of coming forward, and depending on what type of symbolism the patient was expressing, the psychoanalyst would be able to reveal their unconscious desires and innermost thoughts and feelings. All right, so what are some criticisms of the projective tests? Well, critics argue that the projective tests lack both reliability, which is consistency of results, and validity, basically predictive validity. So does it predict what it's supposed to do? And when you think about it, even trained raters evaluating the very same patient produce different interpretations. The reliability isn't great. It's very, very subjective in nature. Projective tests also can misdiagnose a normal individual as pathological. Maybe they just saw a horror movie, and so the baby elephants that I saw, somebody saw as a Satan mask because they just saw a scary movie. So it's not terribly valid, and it's not generally predictive. And that's it for the psychoanalytic theories of personality. In our next video, we'll talk about the humanistic theories of personality. I can't wait to see you then. Bye for now.